So welcome to your education video around the trauma trolley. So I'm going to just start off by talking around the checks first. So as you know, you've got your QR code here, you can scan with your phone or the iPad. The weekly check is done on a Thursday, and that's a full check with all of the expiry dates. And then every day we do a tag check just to confirm that it hasn't been opened. It's not Thursday, so I don't need to open it and do the full check. And there's one other check you can do, which is if the trauma trolley's been used and you're just restocking it, you can scan and do a restock check. But bear in mind, if you've done that one, it does not replace the full weekly check. The full weekly check must be done as well because you're confirming you've gone through every single drawer and done all of the expiry dates. So that's the QR code. On the top of the trolley, it's been very well laid out with areas well signposted with what should be kept where. So it says very clearly, no head blocks to be left on here. So I've removed the head blocks that had been left on here. On the right hand side, we have got the giving set for the Ranger warming device. So for our infusions that we want to warm the fluids, we've got the giving set on the right hand side of the trolley, alongside the internal defibrillating paddles. So these are the paddles that would attach to our own defibrillators if worst case scenario we had to open a chest and defibrillate straight onto the heart. So that's what those paddles are for. We've also got the giving set for the level 1 infuser, which at present the level 1 infuser is in theatres. So the giving set is here, but the infusion device is kept in theatres and would be brought down from theatre to be used. And then finally on the left hand side we've got our trauma paperwork, and this is really important that whoever is scribing would use the trauma pack paperwork and that would be completed. We've got a couple of hooks on the side to hang bits and bobs if you were trying to run lines through, etc, etc. You've got a hook that you can use, and we've also got the adult major hemorrhage protocol algorithm as a separate, because the trauma trolley is kept outside of the resus space. You could use e-resus whilst in with the patient, but the people outside have got their own copy to look at that's attached to the trauma trolley. So that's the trauma trolley on the outside. To open it, it should be tagged so we know that everything in there is as checked and complete. Pull the tag and open the doors. You've got written signs on either door explaining what is in each of the trolleys, each of the trays. So it explains here. At the top drawer, you've got all the PPE that you would need for a chest procedure during a trauma. So all the PPE, full gown, goggles, couple of pairs of goggles, gloves, etc. Everything you would need from a PPE perspective if a chest procedure needed to happen. You've then got everything you would need for an emergency trauma chest procedure, be that either, as it says on the front, a thoracostomy or an intercostal chest drain. So all the kit is in this drawer for that, including your local anaesthetic, which is something a doctor quite often will ask you for, which quite often we then go running to the major's drug cupboard, but we don't need to. We've got it all in here ready. The next drawer down, you've got the stuff for a resuscitative thoracotomy, I did say it right. Everything you need in here, and something I just want to point out that in this drawer we do have sterile tough cut scissors. These have to be kept sterile. They have to be kept in this drawer, and they are not for removing patients' clothes. These are for an emergency thoracotomy, not for cutting patients' clothes off. So if you need tough cut scissors and you don't know where to get your own, please give me a shout and I'll tell you, but do not ever use these ones. Okay, and in this bottom drawer, you've got your chest drain bottles and tubings that you would need. So again, that very much would be a nurse-led job. Doctor would be putting in a chest drain and we would be putting together the chest drain bottle, etc. There is a separate video for you to watch to see how we do that. So that's in the bottom left-hand drawer there. And then top right, we've got the IV access that we potentially would need during a trauma, including some trauma lines in here. Extra PPE, extra goggles, sterile gloves, etc. in here. So that's for your IV access and trauma lines. Then everything you would need for blood transfusion, and that includes a bear hugger blanket, because part of that emergency transfusion is really important that patients are kept warm enough. So as a part of that major hemorrhage protocol, as part of that keeping your patient warm is essential. We've then got another giving set to go into the Ranger blood warmer, but there's a spare one here because we may well be running more than one infusion at a time. So a couple of those giving sets are in here. We've also got tranexamic acid, or TXA. So again, that's another drug that we don't need to run to the drug cupboard for. In a trauma, we've got it locked away in the trauma trolley here. And then we've got our giving sets and extension lines, everything you would need for blood transfusion. In the next drawer down, you've got the bits and pieces you would need for major hemorrhage control. So there's quite a few things that we cover on the trauma study day, so I'm not going to go into great depth, but I think it's important that you understand that in here we've got a CAT tourniquet. So this is a tourniquet for a limb to stop a patient arterially bleeding out. I was going to be very dramatic then. We've also got C-lock gauze, which again, we cover all of this on the trauma day, but C-lock gauze, so this is for a hemostatic, it's got hemostatic granules in. We would use that for stemming a hemorrhage from a wound. We also have blast dressings, which are large dressings that have got elasticated bandaging, so for putting pressure on a bigger area, so big blast dressing bandages. Moving further back, in the back part of this drawer, we have got two types of pelvic binder. Again, there are more videos for your access on the website to show you how to put these on, but we've got two different sorts of pelvic binders. And then we have a couple of traction splints, so commonly known as Kendrick splints, but these are actually called Prometheus, but essentially they are traction splints. We've got two of those. So that's for your hemorrhagic control, or hemorrhage control I should say. Then the second to last drawer on the right hand side is for ENT, so for facial trauma. There's the special mouth props, again more local anaesthetic, some staples, dressing packs, suture packs, everything that somebody would need you to get out for them if we had facial trauma, significant facial trauma. And then at the very bottom we do have C-spine control, so this is where the blocks are kept, not on the top of the trolley. So we've got the blocks kept in that bottom drawer, and we've got a chain, I can't think of the word, you can change the size on the C-spine collar on this one here. So in a nutshell, that is your trauma trolley. Don't ever be afraid to open it, get familiar with what's inside it, read on the doors what it is, and always come and find somebody if you don't know what something is used for, so that we can, constantly learn, constantly be confident with what we're doing in a trauma.